Hey, community, we're back, and I'm Brandy B, the Community NP.
And I'm Brandy G, the Community NP.
And together we are
B&B The Community NPs. So, I'm so happy to be together today.
Oh, my gosh. I missed
it.
So we've been recording via
Zoom. Yeah, from our home.
Yeah, because of what?
The winter storm.
And
just other situations.
COVID. Yeah.
So
today, what are we talking about?
So we're going to be talking about stroke today.
Okay.
I think it's a very important topic, which I think all healthcare topics are important.
Sure.
But stroke, so stroke. It's a lot of my family members, we have a history of cardiovascular disease in my family. And I done had, my grandfather died of a stroke. I done had an uncle to pass from a stroke also. So
it's very common, especially in the Black community.
Yeah, men.
Yeah.
Men at that also. Yeah. So let's get into it. So B, what is a stroke?
So the definition of a stroke is it's a term used when a part of the brain is damaged because of a problem with blood flow.
Okay.
So there's two different types of stroke. So there's a hemorrhagic stroke, which is a bleed, and then there's ischemic stroke, which is like a clot that clogs off one of the arteries that supplies blood to the brain.
So basically, you're not getting any blood flow to your brain, which causes that part of your brain to lack blood flow, and oxygen goes with the blood.
Yeah.
So no oxygen to that part of your brain, which causes you to have a stroke. All right.
And then that part of the brain will either die or
revascularize or come back to life, basically. Okay. So I know also there's TIAs, which is similar to a stroke, but it's truly not a stroke, because what happens is that blood flow gets clogged or blocked, but it reopens
by itself.
Yeah, it reopens by itself. So when somebody has a TIA, they may have symptoms for a couple of seconds, and then they go back to themselves.
Right.
So
So that's kind of a warning sign, and that's what most people call a mini stroke. So when people come in and they're like, "Oh, I had a mini stroke," so the actual term is TIA.
Okay. So some of the facts. Okay. Someone in the U.S. Has a stroke every 40 seconds.
That's crazy.
Every 40 seconds having a stroke. And every 4 minutes, someone dies from a stroke.
Every 4 minutes.
So when I hear these facts, it's alarming, because if you think about it, 40 seconds, what were we doing every 40 seconds?
Breathing.
That's what I'm saying. So someone has a stroke every 40 seconds, and someone dies every 4 minutes in the U.S. from a stroke.
That is crazy. Yes. And the United States spends about $46 million annually, $46 billion annually on stroke-related health care.
So just think, if we can prevent strokes from occurring, and we can't prevent all of them from occurring, but the ones that we can prevent, and this money that we spend on strokes annually can go to other, other causes.
And probably that money could be spent on, more prevention stuff.
Yes.
So, and then stroke is the leading cause of long-term disability in the United States.
Yes.
So what are some of the risk factors?
Having high blood pressure. Yes. Blood pressure not controlled. I preach this to my patients, all my patients who have high blood pressure. I preach the reason why I want them to take their medications. The reason why I want them to eat healthy and exercise is to prevent heart attacks and strokes. So I preach this.
Same.
Even to my diabetics. So having type 2 diabetes, or diabetes in general, puts you at risk for a stroke. And I preach this to those also. Stop smoking, because smoking puts you at risk. High cholesterol.
Take your medicine.
Yes.
Take your cholesterol medicine. We give you these things for a reason.
Yes.
And then, of course, physical inactivity.
Yes.
Having AFib is a common risk factor
for a stroke.
Yeah, and which a lot of people have developed AFib from COVID.
Yeah, because the stress of their body put them into AFib, which caused their heart to beat irregular. And sometimes when your heart beats irregular, you're not on medications, you form a blood clot.
Yep.
And if that blood clot, and your heart starts to beat regular again, that blood clot may get dislodged.
Right.
So.
Yep. So AFib is actually pretty common.
It is.
So if you have that, take your medicine, do what your provider tells you to do, and to prevent yourself from having a stroke.
Yes.
And then also carotid artery stenosis. So that's like when your carotids are clogged.
Yep.
And a lot of times that can be fixed unless I think if it's above 99%, then they won't do any intervention. But just get it checked. And then being Black. That's one of the risk factors.
Males, like I told you, my grandfather and my uncle had stroke. So Black males.
Yes.
Those age 80 and above, the older you get, the more at risk you are for having a stroke. And sometimes genetics. Sometimes like sickle cell disease may put you at risk from having a stroke.
And sickle cell is very common in African Americans.
So we got to do a talk on sickle cell at some point.
For sure.
Okay, so what are some of the signs and symptoms?
So a good way to remember the signs of a stroke is the acronym BFAST, which stands for balance, eyes, face, arm, speech, and time. So BFAST.
So, all right. So let me tell you something. Okay. So I guess my mind go thinking somewhere else when you say be fast. Like girl, be fast.
Don't be fast like that.
Okay. So be fast as far as you want to hurry up and get it seen, get it taken care of.
So balance. You look for if somebody's who normally don't have these symptoms start to develop these symptoms. So they may have trouble standing or walking. They may have trouble with their vision. So maybe even on one side more than the other.
Yes.
Face, so the face may look uneven. The facial droop, so this side of the face may be like drooping down, like
it could
the
be
muscle
either side.
And slurred speech, their speech might become slurred. And then arm, which is part of the BFAST acronym, but your one arm maybe you can hold this one up, but you can't hold this one. It can happen in your leg too.
Okay.
And then time. So if you see these signs, you call 911. Do not come see your primary care provider. Do not wait till mom gets home from work or husband is available. Call 911. Go to the hospital immediately because the sooner you get there, the sooner they can start revascularizing and getting you back to your pre-stroke state.
Yeah. So I had a patient 2 weeks ago who came in to see me, and it was obvious that he had a stroke. So his brother brought him in. He said, he told me that the patient had brought his brother to the doctor. He said, when I got in the car, got back in the car with him, his voice had changed. And he said, I told him, hey, man, something wrong with your voice. You sound different. So he said, they had their mask off, and he said his face was drooped. He was like, I think you had a stroke. My patient was like, no, I'm fine.
Yeah.
He waited like 6 days until he had an appointment with me to be seen. So when he saw me, I immediately was like, you had a stroke. Yeah. So I sent him to the emergency room. Even though it was 6 days later, I told him, I said, I wish you would have went when your brother told you that your voice had changed and he saw that your face was asymmetrical. I wish you went into the emergency room.
Yeah.
But so he did go to the emergency room that day. I didn't see him in clinic. I just went on and sent him to the emergency room.
Because a lot of times, even though it had been 6 days, sometimes still emergency room is the quickest way to establish care with like a neurologist or and just start the post-stroke care. So So how do you prevent?
Okay, so we just talked about this. You want to take your medications. So if you're on blood pressure medicines, diabetes medicine, cholesterol medicines, take your medications. A lot of times they'll put you on a blood thinner. They'll put you on aspirin or some type of blood thinner. Take your medications. Take your medicines, basically. Lifestyle changes. Exercising. Eating a healthy diet. Now, when I say exercising, like we always say, not just walking from the car to the front of the grocery store, walking around the grocery store. Actually getting the heart rate up.
Yeah. Like my favorite thing to say is get the glazed donut look. So start shining, perspiring, working up a sweat. But also, what was I going to say? Stop smoking.
Oh, yes.
Yeah.
Yes.
So smoking basically just destroys your arteries. And so stop smoking.
Yes.
That's huge.
That's a big one.
Yeah.
All right. So, of course, eating less salt, limiting the amount of alcohol that you intake. Like we always say, for women, 1 drink a day. For men, no more than 2 drinks a day. And to be best, sometimes it's no drinks a day.
Yeah.
It's better than the 1 or 2.
Don't binge drink on the weekends.
I didn't have 1 Monday through Friday, so
I'm gonna have
on
7.
Saturday, I'm going to have 10 drinks.
No, you're not going to have 7 on Saturday.
So, okay. So what else? We say exercise. And how often should they exercise?
most days of the week. So there's 7 days in a week. Most days of the week would be 4 or more for at least 30 minutes.
Okay.
And you can break that up. You can do like 15 minutes in the morning, 15 minutes in the afternoon. But like we said, break a sweat.
Okay. And let's talk about the foods. When we say to watch what you eat, are we talking like, is certain foods we're talking about?
Well, watch what you eat, especially like foods that are high in salt. So packaged foods like chips, cookies, canned vegetables are high in sodium. So I know Brandy says she always tells her patients if they're going to use it, because in the population of people that we take care of, you know, resources are limited. Yes. So make changes such as if you used a can of canned green beans, wash them off before you cook them, before you eat them.
Soak them in some water, get some of that salt off of it. And I tell them if they can't do canned goods, do the frozen vegetables. Yeah. Frozen instead of, you know, some of them, the canned vegetables, if they can do that.
Yes.
But I see like there's a lot of resources coming to the communities where they're donating fresh produce to the people in the community. Also, I know that some of the insurance companies, they're giving the patients like a fresh card. It's called a fresh card.
Oh, really?
Where they can go to Walmart and different stores and buy fresh fruits and vegetables. Oh, well, I think it's good. Every month they put money on a card for them to buy that.
That's good. Is that with all insurance?
I know. I think I saw United Healthcare had it. Maybe Humana, but I know for sure I saw United Healthcare had the fresh card.
That's awesome. Insurance good for something.
Yeah.
So, ABCs of prevention, and this is just another acronym to kind of help you know, like how to prevent yourself from having a stroke.
So, what was the first acronym? B fast.
Be fast.
Okay. And this one is the ABCs of prevention.
Right. Okay. So the A, aspirin. Aspirin may help lower your risk for stroke. B is blood pressure. Yes. Blood pressure is the number one cause of stroke.
Yeah, so elevated, uncontrolled blood pressure.
Get your blood pressure under control. As we said before, take your medicine. Avoid salt. That's how you control your blood pressure.
Yes.
Exercise. Eat healthy. And then cholesterol is a C. Control your cholesterol, diet, exercise, medication if necessary, and then
to quit smoking. Like you said.
Again, quit smoking. It's huge.
So that's the ABCs. ABCS. The ABCs: aspirin, blood pressure, cholesterol, and smoking.
Yes.
And I just want to say, before you start taking the aspirin, make sure you consult or talk to your primary care provider,
right,
to see if it's okay for you to take an aspirin.
Yeah, because if you have like GI issues or you're already on another blood thinner, then aspirin may not be a good option for you. So always, before you take any medicine, check with your primary care provider.
Okay. So how do we treat strokes? We've been saying this all along. Taking your medication, hypertension management, cholesterol management. Some people have to have therapy, physical therapy, occupational therapy, or what else? Speech therapy. Yeah, speech therapy. I was thinking speech therapy is also one that people may have. You want to the best treatment is to get to the emergency room.
Yeah,
because sometimes, like we said, they can reverse, help revascularize the areas of the brain that was affected by the stroke.
And if they can restore the blood flow, then they can save that. Usually they can save that area of the brain, or at least save some part of it.
Yes. So you may not have as many deficits if you go straight to the emergency room.
Because after you have a stroke, I mean, it can change your life. So you go from being able to walk, talk, and if the effects from your stroke are severe, you may not be able to move the whole side of your body.
My grandfather was paralyzed on one side of his body after his stroke.
And then some people can't talk. And then we didn't even really get into detail of like some people, you have it in your brain what you want to say, but you can't get it out. Yes. So a stroke can be very disabling.
Life-changing, life-changing. I done seen people who, had prominent careers and had a stroke and they had to go into disability because of the stroke. So if it's something that you can prevent, we want to help you guys prevent having strokes, okay?
Yes. So what to expect after a stroke? So we kind of talked about that, but a lot of people, some people recover from a stroke without any long-term problems or with only minor problems. But like we said, not everybody does. Yes. A lot of people have severe problems from it.
Yeah, speaking, like you say, speech problems, and with the speech problems can come with feeding. Some people can't feed themselves. Some people have difficulty swallowing when they start choking when they eat certain foods. So it's a lot of side effects that comes with paralyzed. You could be paralyzed, or not even much paralyzed. You can have a weakness. If you're not totally paralyzed on one side of your body, it could just be weak on that side of the body.
And with the feeding, you know, it leads to, like, if you have difficulty swallowing, then you're at increased risk of pneumonia. So I mean, it just goes on and on and on. So
it's like a ripple effect.
Yes.
From this, something else happens. Okay.
And then we talked about usually after having a stroke, you usually have to do like physical therapy, speech therapy, occupational therapy. And some people have to have like somebody live with them because
if they have a provider.
Yeah, they can't do anything by themselves anymore.
What they call it, a personal care attendant or something like that?
Yeah.
So you guys, if we can prevent it, let's prevent strokes.
Yeah, and after you have a stroke, it increases your risk of having blood clots and other heart-related issues.
Yes, and another stroke.
Yeah.
It increases your risk of having a second stroke. So we're going to try to prevent strokes, okay?
Yes, we are.
All right.
So disclosure B.
Okay, so as I say every week, these videos is just information. It's information for you to share with friends and family. It does not take the place of your primary care provider.
At all.
We want you to see your primary care provider, okay? At least once a year.
At least.
But more often if you can, okay? Yeah. So just remember, it's just information to share.
Yep. And then so also, as we always say, follow us on Facebook and Instagram. Subscribe to our YouTube channel. Share this information with your friends, your family. And remember that
community is our beauty.
Bye. Have a great day, y'all.